Hi there, my name is Amol Nirgudkar. I'm the CEO of Patient Prism, and I'm live here at our Patient Prism studios at the Women in DSO conference in Las Vegas. And I have with me an amazing woman that just won the Women in Leadership Award,
Thank
Dr.
you.
Jahnavi Rao
Thank you.
from Aspen Dental. Um, Dr. Rao, welcome.
Thanks.
Excited to have you. I just saw you receive this award for clinical excellence. I know you are the VP of Clinical Support for Orthodontics at Aspen Dental, one of our favorite DSOs out there. I'm truly excited to talk to you about the emergence of Aspen as a brand that's transcending to an approach where we're looking at overall health of a patient, and ortho has so much to do with that. How are you thinking about, as we know in the United States or the world, uh, most orthodontic treatment is really done for aesthetic reasons. And what I've learned from just reading is that a lot of people need orthodontics for function. So how do you bridge the gap between people who need it for aesthetics and for the most of the people who need it for function? How do you bridge the gap?
So that's a really interesting concept
Okay.
because orthodontics
Yeah.
is a vital part of dentistry,
Okay.
and it is a prescription service.
Okay.
So when you select a patient or when you select the idea of using orthodontics
Yeah.
and applying it to a patient, it comes from a place of need. And aesthetics is usually a byproduct of orthodontic treatment.
Right. Right.
So when most patients are walking up and asking for straight teeth,
Right.
they may be asking for something that is visually appealing,
Right.
but what the orthodontist or the dentist is providing them
Right.
is a healthier bite, a stable occlusion, maybe a better restoration.
Right.
So in today's world, where we want to provide comprehensive care, we want the best services, it's vitally important to include ortho on those plans.
The problem, though, is that patients are not aware of that, right? Patient doesn't know they have bad occlusion. Patient knows they have a headache, or a patient knows that they're having stomach problems because they can't digest food because they're not able to chew well.
Right.
So how do you? The question is, how do you get patients aware of the need for orthodontic when there is no aesthetic
Component?
component in mind?
Yes. So I think that responsibility lies with the dental industry
Okay.
to create that awareness, to educate our doctors on how to diagnose and how to figure out where ortho would play a role. And we can definitely do better in our dental schools, better in our curriculum, better in hands-on training.
Right.
And that's exactly what we're trying to do at Aspen.
I know you guys recently launched your own clear aligner brand. That's a mouthful. Clear aligner brand. What is that? Tell us a little bit about it. It's called Motto, I believe.
Yes.
So tell us, how did you guys get into creating your own brand, and what was the reason, impetus behind doing that?
So Motto is our clear aligner brand, and it is created specifically for the general dentist to be able to provide services, and it complements a general dental setting.
Okay.
And the idea behind this was really to create a product that can elevate the standard of dental care,
Okay.
right? And we wanted to create a product that was also affordable,
Okay.
because we wanted to create a product that not only provides the service but is also accessible to the patient.
From financial standpoint.
Yes.
From financial.
Yes. And we wanted the product to be easy.
Right.
We wanted our doctors to be able to use it
Right.
and provide a better restorative result or a better overall comprehensive approach to the
Right.
patients.
So part of the rollout of Motto, are you going to also have education included, part of getting your GPs to, first of all, figure out how to diagnose orthodontic conditions, and then drive them through the process of presenting that as a treatment, and then getting them through the process? Is there a training component of this, which kind of you will handle, where you said, oh, here's the questions you ask when somebody comes in and has a headache or has, and there's a whole script behind. How do you really diagnose orthodontic conditions when a patient doesn't ask for them?
So it begins with the doctor journey,
Okay.
which is day one of the doctor joining the Aspen Nation, as we
Okay.
call it.
Aspen Nation.
Right?
Okay.
Yes, it starts with theoretical knowledge, it starts with hands on information. There are live courses that we use, and the idea is to grow the dentist as an all rounder
Right.
and not be just a one pony show. We want the dentist to be able to look at a case and select the exact specialty that'll elevate the result to what they wanted.
That is absolutely amazing because a lot of general practitioners in the orthodontic world lack the confidence to really do ortho. That's why if you look at any aligner company out there, I mean, at most general practitioners are doing one start a month, right? So how do you get them and because again I think it has to do with the clinical confidence around
Absolutely.
being able to diagnose and treat that. And so is Aspen going to provide that clinical confidence to the GPs to get them to first of all diagnose and feel confident about treating that?
Yes, and that is the goal behind providing dental services within Aspen. We want our doctors to be informed, educated, empowered to make choices that make the most sense to them. So we're going to walk them through that journey. There are going to be multiple contact points with my team, which is the orthodontic support team, where they feel that they have a very good understanding of the services that they are providing, and then they can in turn utilize and help their patients out.
That's fascinating. I mean, I'm fascinated by the field of orthodontics because there's so much need out there, but the utilization is so little because people just don't know they need it. And there's not, and obviously as GPs start working in that field, and orthodontists have done what they've done really well over the years, but as the model is getting a little disrupted because of the clear aligners, more and more GPs are engaging in that, but not at the extent they should because again, the training around it has just not been adequate. But I think Aspen's move through you guys is to really provide that support and training and the confidence that these doctors will feel in presenting, diagnosing, and in seeing the treatment through.
Yes, absolutely. There's always going to be a need for a specialist.
Right.
And the idea here is to train our doctors to be able to recognize which cases they can treat
Right.
and which cases need to be referred.
Right.
Because right now, there are a lot of children and adults
Right.
that we can help, but there is, there's a challenge to that because most dental schools don't teach ortho very
Right.
well.
Right. Right.
Or, it's very theoretical and there's no practical implementation of that knowledge, unlike dentures or fillings where, they're learning it every day in school.
Right.
So we are filling that void, we are filling that gap, and we are giving them that knowledge
Nice.
so they can take it and, help their patients and help the community.
What do you think a dental patient would get that would it include a comprehensive health, orthodontic, dental evaluation all in one visit?
Wouldn't that be wonderful?
It would be fantastic.
Yes. And I think that would be a great question to pose to our elite leadership because they have some wonderful, wonderful ideas and they are literally working on it every day to make lives better for people in the community.
So if there is a Dr. Aspen and they have a complicated case which requires ortho, they can always come back to your team and you guys will help.
Oh, absolutely. We have a very robust support system.
Okay.
Our doctors can pose a question to us and literally in seconds they get a response.
Wow.
They have access to a clinical team, they have access to the dental support team. So we made sure that our doctor has all the resources he could possibly need right on his fingertips.
I mean, that's what makes the model really amazing because it allows doctors to be more confident and it eventually leads to more treatment and better lives for people.
Better
right?
standard of care.
Absolutely.
That's what we stand for.
Absolutely. You won this award today, Leadership in Clinical Excellence. What does that award mean to you?
It's a very humbling experience.
Okay.
Because I wouldn't be standing here and you wouldn't be interviewing me had I not had a fleet of amazing supporters within Aspen Nation that propelled me to go against the grain, to challenge myself, to reach out, to do the impossible. So it is truly very humbling.
What do you think? We're here, this Women DSO event. What do women bring into the perspective conversation that men that necessarily don't bring in terms of leadership? It's a question. It's a hard question. I don't know, but I kind of have thoughts about it. But I'd love to know your thoughts. As you've sat in organizations where could have been all men, and you could have been the only person. What perspective did you bring, and how did Aspen encourage your perspective in the process?
So I think whenever you bring in someone who's different,
Right.
it brings with it layers of opportunities.
Right.
And those opportunities could be in the form of ideas, they could be in the form of feedback, it could be in the form of subtle leadership skills.
Right.
And Aspen has been tremendous in providing that platform to women. I mean, we have a robust group of very fierce, intelligent, but very balanced women. And I feel fortunate every day to be able to interact with them, to lean on them for support, because we've all had good and bad days.
Right.
And,
Absolutely.
there's some days you just need someone to say, you can do this, hang in there.
Right.
And then you also need someone to nudge you,
Right.
to kind of push you and be like, you sure?
That's right.
Can we do better than this? And Aspen and the Aspen leadership has given us that platform to interact
Nice.
and elevate all of us, like from ground level all the way up. And I know you've met quite a few of our executive team, and I'm sure you could tell that vibe within the company of how empowering it is.
I fell in love with your story when I talked to Bob a few months ago at your headquarters in Chicago. I fell in love with the passion that Aspen shares to change people's lives, and it's beautiful. It's beautiful. It's sincere. It's extremely sincere, and it's more than just building a big company. It's really about empowering people to lead their best lives, and I'm so proud of to be in this industry that just continuously work to bettering people's lives and health, and in the field of orthodontics, you're doing more than health. You're giving them the gift of confidence and beautiful relationships and everything else around it. Dr. Rao, thank you so much for coming here. It's been a pleasure and honor talking to you, and congratulations on the award.
Thank you so much.
Absolutely. Thanks.